Justice Diversion Evaluation, Measuring Success Through a DEI Lens. So I am Danny Soto. I am the Associate Director of the Research and Action Center at Impact Justice. I am a researcher. I have never done direct service. I like to preface that because I absolutely defer to your all's expertise in serving your communities. With that said, I do see research as playing a really important supportive role in partnership with those who are actually doing the work, who are actually serving clients and program participants. So I've worked in partnership with community-based organizations, with county, state, and local government departments and agencies for about 7 years now. Prior to that, I was an assistant professor, so I'm a recovering academic. But I love working in partnership with folks who are doing really, really, really important work. And so for me, it's a great opportunity to do mission-driven research that can have a real impact on people's lives. So thank you for allowing me to share this space with you today. I'm also a criminologist and a sociologist by training. I'm also a first-generation college student, the daughter of a formerly undocumented immigrant, and a queer and non-binary person. So I bring all of those lenses with me today, both based on my personal experience and my formal training. And so you can get an idea of why I care so much about making sure we're centering marginalized communities and making sure that their knowledge is also brought into our work. Okay, so just a quick overview based on our first polling question. I'm not sure how many folks have been in the first 2 sessions, but that is perfectly fine. Each session is also designed to build on past sessions, but also stand alone. So we've already been through session 1, kind of a state of affairs. Introducing the sequential intercept model is a way of thinking about the different points at which diversion can happen, the different points in the justice system at which diversion can happen, right? Because diversion can happen before justice system contact, at the law enforcement level, at the court level, at the reentry level. There's so many different intercept points. Our last session in January, we talked about evidence-based and community-defined diversion practices. And today we are talking about evaluation and measuring success. And then our next session, our last session in this series in June, we'll talk about sustaining justice diversion systems change. And so I hope many of you will join us for that as well. So today's learning objectives are hopefully that participants will gain knowledge of evaluation basics, that participants will understand how to define and measure success, and that participants will understand how to apply a diversity, equity, and inclusion lens to their evaluation efforts. Hypothetically, hopefully, you all have an evidence-based program or a community-defined program up and running in your county, in your agency, in your organization. You've got it up and running. How do you tell if we're making progress towards our goals? How do we tell if the impact that we're making is equitable and inclusive, meaning that it's not only successful for one population and excluding another? And so the first larger question there is both, I hope everyone is ready for this presentation and discussion, but also, are we ready to start answering those questions? How do we tell if you're making progress? How do we tell if your program is having an equitable and inclusive impact? I want to start with a quote, thank you for indulging me, from one of my favorite researchers. Raewyn Connell is an amazing sociologist who studies gender. And she is really conscious of pulling in information from marginalized communities because it's often excluded. And so Raewyn says, research is something that everyone can do and everyone ought to do. It's simply collecting information and thinking systematically about it. And so the reason I put this quote here is because I really truly believe this. I believe that doing research doesn't require a whole lot of formal training. I certainly had a whole lot of formal training because this is my passion, but it's something that I fully believe anyone can do. The first step in thinking about how do we answer those questions, are we making progress, are we having the impact that we want to be making, is to kind of do a step back and see what information is already available. So in pairing with that question is what information is needed? What information do we need to gather based on your theory of change, based on your logic model, based on the goals of your program? What information do we need to gather? And then what information is available? This is the first step of any of our projects that we engage in as well. So the first kind of most obvious source of information that's hopefully already available is programmatic and administrative data. So this is the information that you're already gathering just as a normal part, a routine part of your programming. You might have intake forms that have people's basic demographic information. It might include their contact information. You might be doing assessments of various kinds, risk needs assessments. Maybe you're doing, mental health or behavioral health screenings. That's all information. Are there records of program participation, things like attendance? Are there records of how often staff are interacting with folks? Some programs might include, regular phone calls or home visits to check in on folks. Are those records being kept? Do we have any information directly from participants themselves? Are there any client surveys that you're doing? Are there any exit interviews? Are there any, written feedback forms that you can draw information out of? So that's the first step, is to kind of see what's already there. Another source of information might be case notes, where staff or case managers are kind of reflecting on the progress that folks might be making, maybe including more information about challenges they might be encountering, things like that. And then there's also potentially information from referral partners, both on the intake or the referral form coming into your program, but there's also potentially information that you might be gathering when you are making referrals to other resources outside of your program, or referrals that you're making upon discharge or graduation, or when someone completes the program, if it's time bound. So for example, just kind of backing up to the beginning there, for example, if we believe that, say group therapy along with other supportive programming provided will have a positive impact on someone's level of independence, right? This is all hypothetical. Then we know that we would need to capture information on group therapy attendance, on other programming participation. And then, we're wanting to have an impact on someone's level of independence. How are we measuring independence? What do we mean by independence in this context? And how are we getting input back from clients and participants on how are things working? Are they getting the programming supports or other resources that they need, right? In addition to this basic, kind of baseline level data that we're looking at or looking for, this is also a good opportunity to use that DEI lens and ask ourselves who is included, who might be left out, and paying special attention to historically marginalized folks or marginalized communities. So when we're looking at demographic information of program participants, does that align with what we know about our target population? For example, most of my work takes place in some kind of connection to our justice system. And so we know from other research, from decades of research, that the folks who are justice impacted are more likely to be people of color and are more likely to be marginalized on SOGI, on sexual orientation, gender identity, and expression, just for one example, right? So if I'm looking at demographic information of my justice-related, justice diversion program, are we serving mostly people of color, for example? If we are serving mostly white folks, we know that that does not necessarily align with our target population, right? So this is important, an important moment to stop and reflect on who's being included and who might be left out. Okay. And so when we're applying that DEI lens, we want to explicitly look for those marginalized folks. Is your program, are your services reaching them? What barriers might be there if we're not reaching them? Are services culturally relevant and affirming? Do you have staff from similar backgrounds, et cetera, right? And so as part of this process, it can also be helpful to create kind of like a data flow map or a data flow chart, kind of identifying what information is captured, at what point in the program is information captured. Is this at intake? Maybe this is a survey that's given after week 6 or after week 8 or whatever. This is the exit interview that we'll use when folks kind of graduate or move on from the program. So what information is captured? When in the program is it captured? How is it captured? Is it captured electronically on paper? Is it a survey? Is it an interview? And then also who's responsible for those pieces. So that can just give you a broad overview of, okay, what information is available so that you can be most efficient in further data collection. So you're not recapturing or regathering information that you already have. You can be really efficient and not kind of reinvent the wheel. When it comes to measuring success or measuring impact, right? Different stakeholders define success differently. I'm sure you've probably encountered this already, that funders might have a specific idea of what they mean by success or what they want to see as evidence of success. Your larger community might have a different definition of success. In the case of justice diversion, the larger community's number one concern might be something like public safety. How does this program impact my actual safety or perceptions of safety in my community? That might be the number one measure of success for larger communities. Participants also have their own understanding and knowledge of what success looks like for them. What are their goals? How are their goals being worked towards? So this can be complicated. Measuring success often is not as straightforward as it would appear in a nice, neat logic model, right? What we should be doing, what we should be pushing ourselves to do is to try to answer, is anyone better off? Are any of our clients or participants better off, and how? This moves us beyond just recidivism. In my field, in the justice world, recidivism is often seen as the number one indicator of success, as well as the quote unquote most important indicator of success. It is one indicator of success. If someone had previous justice system contact and as a result of program supports, resources, services, never has contact with the justice system again, that is absolutely a good thing. That's absolutely a good thing. But does that really, or how much does that tell us about how better off someone really is? Does it tell us anything about their well-being, about how they think about themselves? Another added complication here is that measuring recidivism in and of itself is also complicated. There is no standard way to measure recidivism. Some folks measure it as any further system contact. What best practice would suggest, especially coming from an equity perspective, is that recidivism should be measured as a new sustained charge, that really resulted in a significant and quote unquote real kind of system contact. This kind of pushes against or resists definitions of recidivism that involve technical violations, meaning violations of the conditions of parole or probation. Oftentimes, those things are not in and of themselves crimes, nothing that you or I, if we were not on probation, nothing that we would get in trouble for, but it's an added layer of kind of surveillance and supervision that's placed on folks. Ideally, we would not use a technical violation as an indicator of recidivism. Similarly, being rearrested is another commonly used definition of recidivism. However, moving beyond arrest to actually having a sustained charge indicates, at least on some level, that that arrest was made correctly. We know that plenty of folks are arrested mistakenly for charges that are not sustained, and for being in the wrong place at the wrong time, or for being suspected of having committed a crime. And so arrest is not always the best. Well, I would say it's never the best indicator of recidivism as well. So recidivism aside, how else are we going to be measuring success and impact on participants? And so in the world of justice diversion, we often, again, look at lower recidivism as an indicator of success. We also often look at better mental health or behavioral health outcomes. Oftentimes, justice diversion occurs because of the knowledge that someone is dealing with a mental health or behavioral health challenge that is better served outside of the justice system, or is actually the underlying cause for their justice system contact. So thinking broadly about how to measure success and well-being is really important. And then with the DEI lens here, it encourages us to ask, how would participants measure success? How do they think about their own progress and their own goals and their own success? This can be a really powerful exploration with your participants and with your clients, and can have a real benefit to your program if you're able to measure success on levels beyond just recidivism and on levels beyond just what is required by, say, funders. It can really expand your data collection and what information you're able to look at in a really productive way. And so once you have done the data scan, you know what information is already available. You also have an idea of how you would ideally measure success, depending on what your goals are for your program. The next step is then to ask, okay, what information is missing? And it is okay. It is actually something that, when we're going in to do an evaluation of a program or an initiative or a project, that's the first thing we kind of do outside of the data scan is think about what is missing. And so it's sometimes what's missing can be worked back into the process so that it's gathered on a consistent basis. But sometimes you just need additional information in the moment for your evaluation. So what information is missing? And then think about what tools are the best to gather that missing information. So say that, one of our goals was to increase or to decrease negative mental health symptoms, right? So whatever that is, maybe we're thinking about like somatic, like body related trauma symptoms. And we realized that we have some information in case notes based on staff observations or conversations with participants, but maybe this is a good opportunity to think about asking the participants themselves, when is the last time that they, or in the past week, how often did they experience the following kind of feelings or symptoms, right? So you might encounter some missing information. Next is what tools are best to gather the missing information. Broadly speaking, there are so many different ways of gathering information, and often we only think about surveys or interviews. And honestly, that's probably what I'm going to talk the most about. But there are really creative ways of gathering information from folks, and gathering information from younger people, even children versus older people. Think about the linguistic diversity that your clients might bring in terms of languages spoken. But there are different ways to gather information, but they generally fall into two general buckets: quantitative versus qualitative. So broadly speaking, quantitative refers to anything that can be quantified or turned into a number. So the polling questions that everyone did at the beginning, those were quantitative questions, right? You select your answer, you're not typing in physically, unless you had an other, right? Then you wrote it in the chat. But if you selected one of those options, that's quantitative data. Qualitative data generally refers to information that's stored in words. So the information that you shared in the chat, that would be qualitative information. The case notes are qualitative usually. Assessments might be a mixture of quantitative and qualitative, where maybe you're asking someone about, on a scale of 1 to 10, how do you feel today? And then you might dig in a little deeper and have a conversation about that. Some things to keep in mind about quantitative versus qualitative data. Quantitative data tends to be a bit more straightforward to gather, in the sense of you have your polling questions, you have your survey, you have some kind of form that is hopefully clear and easy to fill out, not overly complicated. It's straightforward. People check boxes. You can count those boxes. It's pretty straightforward. However, a caveat here is that it's harder to know if quantitative data collection was quote unquote done right, because we often don't see the process. We often don't look at the process. We often don't actually see the process. All we see are the surveys that were filled out or not filled out, or we see the form, or we see the polling question, or whatever it is, right? All we really have is the data, unless we're consciously gathering information about the process, which is, kind of a different conversation. A benefit of quantitative data can be that it is relatively easy to analyze large amounts of data. It's ultimately a lot of counting and slicing and dicing, but it can be straightforward. Even if you have a large volume of data, we have tools like, even Excel is much more sophisticated these days in helping us look at information in different ways. And so quantitative data is generally good at getting at broad information. So if you need information on a lot of different areas from a client or from a participant, putting together a strong survey, again, that's clear, not overly long, not overly complicated, but that hits on those different areas, that might be a really efficient way of gathering that information. And so you're going to get broad, you can get a broad swath of information through quantitative approaches. Qualitative data, on the other hand, can take a bit more time. It can be a little bit more complicated to analyze large amounts of data. So think about going through 50 different assessments and getting a sense of what are the symptoms that your clients are experiencing most often, or what are the maybe diagnoses that your 50 clients are experiencing. Now imagine reading through 50 participants worth of case notes, right? A very different, more time intensive endeavor, right? However, qualitative data is really good at getting at deep information, right? What you get from the assessments is going to be broad, but a little bit more shallow, right? Digging into the case notes is really going to give you more context, more background information, more probably of the detail that you're looking for in painting a full picture, right? Putting together a whole picture. So important contextual questions can be built into the tool more easily with qualitative data than with quantitative. And it's easier to make qualitative data collection feel more personal. We'll talk a little bit more about this in a minute, but it can feel warmer, it can feel more relationship centered than handing someone a survey, right? And so we can think about ways that our data collection can also help support our programming, not just in the sense of extracting data from someone else or extracting information from someone else, but actually helping to build those relationships, those trusted relationships that are needed in virtually any program that you can think of, right? DEI lens, right? Our DEI lens would suggest to us that we should assume that we have missing data. We should assume that we are not perfect, that we're all human beings, that the curriculum that we're using or whatever data system was already set up probably has some blind spots. If we assume that we have missing data, it prompts us to go looking for it rather than just look around and think like, is there anything missing? No, nothing that I can think of, right? Which is okay. But I think it's a better kind of mental exercise to assume that we have missing data and to think strategically about where can I find evidence of this missing data? How do I address the gaps in our data collection and things like that? And then just to sum up is just a reminder that an ideal, sorry, I just have to move my toolbar a little bit. The ideal data collection process or system would include a mixture of both kinds of information, both quantitative and qualitative. Both have their purposes and both have their strengths and their weaknesses, their pros and cons. And so going in with that perspective can be really helpful in thinking through how to make sure that we are painting as complete of a picture as possible, both in terms of what the program is doing, how do we capture all of the activities and work that we're putting into it, and then also how is that impact showing up on participants. I've talked with so many of our partners, both in government agencies and county agencies and community-based organizations, who are frustrated because they feel like their data, their information doesn't tell their story, doesn't tell the real impact of the hard work of their staff, the dedication of their staff, and that kind of thing. So thinking about where are opportunities to get some of that more rich information can be really helpful, as to the extent that you might be struggling with the same thing as well. Data collection can often feel like a chore for folks, can often feel like it is an add-on to what the real work is. And I don't mean to imply that data collection is more important than actually helping people, but I think it is a really important supportive tool that can help us better help people. And so building in data collection into our program service delivery as smoothly as possible, I think is both an achievable goal and also an important one. I want to pause and acknowledge that data collection is often, but does not have to be, impersonal. It doesn't have to be dehumanizing. It doesn't have to be extractive, and it doesn't have to be exploitative. In my mind, from my perspective, good research, good data collection is never any of these things. However, many of us, perhaps, and I would be willing to bet that many of the folks that we're serving have experienced data collection in some of these ways that are really impersonal, ways that are dehumanizing, ways that feel exploitative. And so I just want us to hold that information as we're also thinking about how to weave in our data collection in both an ethical way, but also kind of a natural way into our flow. It's important to note that information has often been used against people, especially those who are most vulnerable. In our context, those who are justice involved, information that is gathered can be inadvertently and or consciously used against folks if they move deeper into the justice system. Those who are undocumented, right? That is an important piece of information that is often used against folks, right? In a punitive way, if folks are undocumented, if folks are mentally ill, if they are actively in crisis, if they are concerned about their children being taken away, if XYZ happens. So we should be conscious of the information that we're gathering, and we'll talk more about data sharing and collaborative data collection in a minute. But those are things that we should be keeping in mind. When it comes to data collection, centering participants and their communities is essential. So thinking through, to what extent does my population include, undocumented mothers who might be really genuinely and for good reason afraid to interact with your program because they're worried about how that information might be used against them. So thinking through who your participants are and the communities that they come from, and what they may or may not be willing, or what they may or may not be hesitant to share, even if it's important for your program to know. If you are serving a mixed status family or things like that, right? It helps us think about how do we communicate to participants why we're gathering this data, how we're going to use it, who has access to this data, how will we protect your information? Those are all important conversations to be having with clients too. We should be considering not only the specific tools that we're using, whether it's an outside tool that's been developed and validated, in the world of research, and we're bringing it in, some kind of assessment or screening tool, or whether it's a homegrown survey or exit interview. We should also be thinking through how will this information be collected? How will these tools be used? Thinking through things like, who is administering it? Is this a form that I'm just handing someone, or I'm just sending a link to someone for them to fill out? Or am I sitting with somebody and walking through a survey or walking through a motivational interview or something like that? What is the setting? Do people feel like they have the necessary level of privacy to answer the questions that you're asking them? If you're asking them really personal or sensitive questions, does it feel like a safe private space? Things like that. Related to this is who else might be in the room. Not only their own family members or community members, if they're in their home or in the community, but is this person incarcerated? Are they sitting in a jail cell? Are they sitting in the hallway at a courthouse? Who else might be around that might be privy to information that might hinder the responses that someone might give? Is the tool accessible in terms of language, in terms of reading level, and in terms of the wording that is used? It should be straightforward and easy to understand, right? It should be culturally appropriate. Are any questions sensitive? Are any questions potentially activating or triggering? In some of the work that we're doing right now, we're exploring the role of untreated trauma in the lives of men who've been incarcerated for serious and violent offenses. So we go in with a lengthy introduction well, first of all, people know what have an idea of what the content of the survey and or the interview is. And then we have a lengthy introduction, just letting people know that they can stop at any time, whatever kind of protections for participants that you need to put in place. So the same assessment administered by the same person may look or feel very different based on the setting, right? So thinking not only about whatever the electronic tool or the piece of paper or whatever it is that we're using, thinking through the whole setting to the extent that we know or can anticipate is also a really important component of data collection. So building off of that, collaboration in data collection is often essential to the work that we're doing, especially if we're talking about justice diversion, right? Justice diversion implies diverting away from the justice system to other systems or resources or supports, right? And so the idea is that these resources and supports are ideally not necessarily a part of the justice system, but that they are separate from the justice system, right? That's the diversion piece. We're diverting people away. So that pretty much, in most situations, I would think requires some level of data collection, collaboration, and sharing. And there can be a tension between protection of information and sharing information, right? But even that tension in and of itself really just encourages that we move toward those formal written relationships that have clear MOUs or data sharing agreements or whatever that formal agreement looks like, because it allows both for that formal relationship to exist and also allows us to outline very clearly what information will be shared, what purpose it will be used for, who is responsible for that. And so that process both allows for smoother data collection, which is great, and also allows everyone to be clear about what information is being shared. And so here on this slide, we see kind of a continuum that illustrates the continuum of the kind of the strength and formality of relationships between systems when we're thinking about data collection and data sharing, right? So we have level 1 is kind of minimal. That maybe just means that this agency has a referral relationship with another agency, right? That's basically it. We refer clients or we receive clients, that's basically it. Levels 2 and 3 are basic level relationships. The level 2 would be, okay, we have shared MOU protocols. We understand how you're operating. You understand how we're operating. And hopefully we're clear on that. Moving up a level to level 3 would be a formal relationship, right? I'm doing this, you're doing this. This is how we're going to work together. This is the purpose of us working together. And this is the information that we need to share in order to work together, right? What kind of, if I'm taking a referral from a law enforcement agency, what information do I need from them in order to effectively, right, kind of have that warm handoff with that client? Or if I'm referring out, what information do they need from me in order to make that transition and that referral as smooth as possible, right? Level 4 and 5 are both close relationships. Level 4 would be a formal written partnership documenting all the things we talked about, and would also include actual data sharing. So, but this would probably not be at this level in 24/7 or real-time access. It might be, maybe I get a data dump once a month or once a quarter or something like that, where like we're sharing the pieces of data that we've agreed on, but it might not be in real time. And then level 5, the highest level of close relationship, this would look something like air traffic control, where there's eyes on all of the different planes in the sky. There's a plan for what plane is going to land where and when precisely. And this requires sharing data and coordinating across agencies and organizations in real time, or as close to real time as possible. So continuing along, so this is just a good kind of check as you're thinking through what are my relationships with my partner organizations. What level are these relationships, and is there room for growth that might benefit both your program and your participants? And so when it comes to this data collection, the goal is real-time data sharing and strong relationships between partner organizations and agencies. With that being said, also being mindful of who has access to what data and for what purpose. It might be important for you, because of the way that your program is set up, to know if someone is documented or undocumented, but you will want to be careful about who you're sharing that information with, right? Again, formal data sharing agreements or MOUs are really helpful in clarifying roles, responsibilities, expectations, all of that stuff. Keep in mind that MOUs and DSA, there is data sharing agreements. I should have spelled that out. But MOUs, so memos of understanding, and data sharing agreements can take a long time to get set up and formalized. Some agencies and counties and systems work faster than others, but I think it's better to anticipate longer lead times. So starting sooner is better, right? There are both, just kind of bureaucratic steps that have to be gone through. And there's also some conversations that might need to be had in order to get people on the same page, right? Maybe a partner is asking for data that you feel uncomfortable sharing, or maybe you need data that a partner is saying we can't share, that it's protected, right? So you might need to have some conversations before you're on the same page and ready to move forward. And then it's always important to clarify who owns the data and who owns which pieces of data. Generally speaking, if you are gathering the information, you should be considered the owner of that data. And any data sharing agreements shouldn't, in the most cases, shouldn't involve you kind of relinquishing access to or use of your own data. And then with our DEI lens here, thinking through how could this information be used, quote unquote, against someone? Or how could this information be used in ways that they would not consent to, right? I worked at a youth serving organization for a few years before Impact Justice. And one thing they were very, very clear about was that they were not going to share externally any photos of their youth participants without their express consent, right? They felt that that would be violating their privacy, that would be potentially exploitative because they were serving low income and, quote unquote, at-risk youth. And so, thinking through, would someone agree to their information, whether that's a photo or their survey results or a quote from an interview? Would they have consented for that information to be used in this way, right? The best way, of course, is just to ask someone, is it okay if I use this quote in our upcoming newsletter? Is it okay if I use this photo, as the cover of this report? The best way is to just ask folks, but also thinking through, particularly when we're talking about data sharing and collaboration, could this information be used against the person or in a way that they would not agree to? It's a really important step. This is basically just an outline of a typical research cycle that hopefully might already exist at your organization, but let's just go ahead and walk through it. So in the planning phase, this is basically what we've kind of already walked through up to this point. Doing a data scan, what data is available? Do we have a data collection plan in place for any gaps or any missing information? Do we have a rough idea of how we're going to analyze this data? We don't have to have everything lined up right now, but it's good to plan ahead. Do we have the resources in place? The staff training, the staff time, the staff buy-in, which is also kind of a separate thing. Do we have all of those pieces in place? If so, then we're ready to move into that green section of the circle, the do. The do is where we're actually developing our data collection tools. We might engage in a pilot phase if that is needed, right? Maybe this is a really different way of collecting data than you've done before. And so maybe you want to try it out for 6 months, right? But have a clear idea of what that pilot phase, how long it's going to last, what does that look like? And then of course, engaging in data collection. Then we move, once we have either enough time has gone by or we have the volume of data needed, we move into the study phase. This is where we analyze our data, where we look at, okay, who are we serving? How much service did we provide? Is anyone better off? How? What progress has been made toward our goals? This is also the time when you reflect on, you study, what have been our successes so far, right? Where have been our home runs where we really were really successful? What were the challenges we encountered? How did we deal with that? If we haven't dealt with it, this is a good time to really dig into what do we need to overcome it or to address that challenge. So really digging into all the information that you've gathered, both from participants, but also from staff, what's working and what's not. Your staff often have, they're the closest to the work. And so they often have really valuable insights into what's working, what's not, what are clients' needs, that kind of thing. Then we get into that purple section of the circle, the act phase. So based on what we found in the study phase, what needs changing? It's okay to change. We should be changing. We should be flexible, right, in our approach. When we see something that's not working, being able to tweak, being able to change. Do we need to make changes to our data collection tools? Maybe we got to the study phase and realized like, oh my gosh, we didn't even think about this. Or we tried to measure, reduction in depressive symptoms in this way, but it doesn't really seem to be working. We need to think about a different way to do it. So what changes to data collection tools? Maybe data collection methods are there. Maybe what we thought could be a straightforward survey really needs to be a conversation. Or maybe the interview protocol we put together really could be a survey, right? So really thinking through what changes do we need to make. And so decision-making happens here, right? Decision-making happens here in terms of what changes are we making, what tweaks do we need to make, and that kind of thing in order to inform, right? This is a cycle. It's a cycle. So we make decisions to inform the next planning phase, right? And then the next data collection phase and the next study phase. And so I don't mean to imply, so you see on the slide here, this cycle should repeat regularly, right? What regularly means might look different for different programs. But I think it's realistic to think that you would be able to think through the cycle of your work, the natural cycle of your work, and when you can build in, when you can layer on top of the plan, do, study, act. I also want to acknowledge that this can seem artificial when you are actually doing work, serving clients, providing services all the time. That work doesn't stop so that you can go aside and do this plan, do, study, act cycle, right? For it to be really successful and really impactful, it has to happen alongside, right? And that the program is able to be flexible when we get to that act phase. Okay, what new changes to the forms are coming? It happens on a regular basis. Like we're just making improvements, right? So along with this plan, do, study, act cycle, we should also be looking at fidelity, meaning if you are using an evidence-based practice or an evidence-based program or approach or method, you should also be gathering enough information that tells you, are you following what the model suggests that you do, right? It is okay if you are making tweaks or you're customizing the program to your population. Those tweaks and that customization is totally fine. Copy and paste programming doesn't always work well, right? In different places with different populations, all of that stuff. So tweaks and customization are okay. It's just really great if you can document what those changes were and why you made those changes, right? We realized that we weren't reaching the Latinx population like we thought we were. So we translated all of our recruitment materials into Spanish and keep moving on, right? So just document, keep track, meeting notes, or keep revision histories of your documents and forms that you're using, things like that. One thing that we want to do is make sure that the changes that we're making are contributing to success, right? That they are actually working. We might have to try out a couple different things before we land on, what exactly is that special sauce or what exactly is leading to program success. An important thing to note here is that ideally, decision-making, all decision-making should be incorporated into the ACT phase. It should not be separate from this process. If you want to truly engage in data-driven decision-making, then you need to do data collection, analyze that data in order to inform those decisions, right? Data-driven decision-making. So the ACT piece, it can be tempting to be really reactive and potentially overcorrect in the moment. But if you have a strong plan, do, study, act cycle set up, and it is occurring on a regular basis, you will have natural times to make the changes that you need, and you can make sure that you're doing it in a deliberate way that is in response to your own data and your own data analysis, so that it doesn't seem confusing, so that it's cohesive, so that decisions are built on information and are always kind of referring back to that information. I also want to acknowledge that this takes work. This is not, I'm not trying to pretend that this is just, you wave a magic wand and you have a plan, do, study, act process in place and it's no problem. And it's, this is work. It's work, but the payoff can be huge. This is also a really great opportunity to engage staff. Engaging staff in the process, explicitly asking them to share their expertise and asking for their input on what information to gather. What should the forms look like? What should the surveys look like? Ask for their input on how best to weave this into their work, right? Rather than me thinking, well, this should be the third form that you fill out on intake, right? Asking them, where's the best place to kind of slide this in, right? You can include them in the debrief in the study section of the cycle, right? When you're analyzing the data, what progress has been made toward goals. The progress that you've made towards goals is in large part thanks to your staff, right? So seeing how their work is contributing to visible success, even though we know that their success is much larger than what you could distill onto paper, having them be part of that process can be really, really powerful. It can also really help to increase buy-in and strengthen or even start building a data-hungry culture where people want to see the impact of their work show up on dashboards, show up in reports, show up in fundraising materials and outreach materials, things like that. Finally, in closing, just leaving you with another quote from one of my research heroes, Zora Neale Hurston. She was a researcher and a journalist during the Jim Crow era at a time when women, especially women of color, were super rare voices in research and journalism as well. Her perspective is that research is formalized curiosity. It's poking and prying, but with a purpose. So again, I like quotes like these because they help break it down and kind of demystify, sometimes we think about research as only being done by quote unquote experts, as being done as a separate component of program administration, but it really can be a powerful tool to be woven in throughout. And again, I really fully believe that anybody can do research. Feel free to reach out if there's anything that we can assist you with.